Hey everyone, and welcome back for another deep dive.
It's great to be back.
Today we're going to be talking about something that's super important to all of us here at Sugar Notes,
That's right.
and that is diabetes management and some of the mistakes that people often make.
We see it all the time.
We do.
And we really wanted to kind of dig into that.
We've got two great sources for this.
Yes.
One is a piece on WebMD called 9 Diabetes Mistakes and How to Avoid Them.
Right.
And then the other is a really fascinating scientific article called Mistakes, Misunderstandings, and Controversies in Diabetes.
Yeah, and both of those really hit home diabetes is not just about numbers and science. It's about real people making choices every day and
It is.
facing challenges.
Absolutely. And speaking of challenges,
Yes.
let's talk about medication.
Okay.
WebMD points out that 60% of people with diabetes don't take their meds as prescribed.
Oh, that's a big number.
It's a huge number.
Yeah, it's really important to take your medication exactly as your doctor prescribes it.
It is.
Because, even tiny little changes can impact your blood sugar.
Right. And I think sometimes people think, oh, well, if I skip a dose or if I,
Right.
adjust it a little bit, that's not a big deal.
Yeah, but it's like a symphony.
It is.
All of the instruments have to be playing at the right time
Exactly.
to make it work.
It's all about that balance.
Yeah.
Right. So,
And we know life gets in the way sometimes,
oh, yeah,
work schedules and all that. So it's really important to talk to your doctor.
it is.
If you're having trouble sticking to the schedule, 100%.
Yeah. They might be able to adjust the timing or,
Right. Or even change the medication
right.
to
yeah,
something that works better for you.
absolutely. Now, let's talk about dehydration.
Okay.
This is another thing that can really sneak up on people.
It is. And it's easier to get dehydrated when you have diabetes.
Yeah. And it can really send your blood sugar levels up.
It does, because when you're dehydrated, your blood sugar becomes more concentrated.
Right.
And that's why it's so important to drink plenty of fluids, but
Hey, but
not just any fluids.
not just any fluids, because sometimes,
Yeah.
you reach for like a fruit juice or a soda thinking, oh, this will hydrate me.
Right. Those are loaded with sugar.
Right. And then you're kind of going backwards.
It's like one step forward, 2 steps back.
Right. So what are the good, what should we be drinking?
Water is always a good choice.
Water's always good.
Yeah, and you can jazz it up a little bit by adding some cucumber or mint or lemon or something.
I love putting berries in my water.
Oh, that sounds good.
It looks pretty too.
Yeah. Sparkling water
Sparkling water.
is another good one.
Yeah.
Unsweetened flavored water.
Yes.
And if you really need that little bit of sweetness, talk to your doctor about diet drinks. See if those are okay for you.
Okay, now this next one, I think, is where a lot of people get tripped up.
Okay.
It's carbs.
Carbs.
I think there's a lot of myths and confusion out there
There are a lot of myths.
about carbs.
Yeah, one of the biggest ones is that some carbs don't count.
I've definitely fallen for that.
Right, like brown rice or whole grain bread.
Yeah, like, oh, it's brown.
Right.
It's
Yeah,
good.
Must be fine.
Right, so tell us what's the truth.
So the truth is all carbs break down into glucose.
Okay.
And glucose is what raises your blood sugar.
So it doesn't matter if it's white bread or brown rice.
it still affects your blood sugar.
Okay.
So even those healthy carbs, you got to factor them in.
So pasta, rice, fruit.
All of it.
Okay, so it's not about avoiding carbs.
No.
It's about understanding how they affect you.
Right. And that's where the glycemic index comes in.
The GI,
The GI, yeah, it ranks foods.
based on how quickly they raise your blood sugar.
Exactly. So the lower GI foods release glucose more slowly.
Right, so those are generally
Yeah, those are your friends.
better choices.
Yeah.
Now, another mistake we see a lot
Okay.
is people not getting enough exercise.
Yeah. I think people get tired of hearing about exercise.
I know, but it's so important
It is.
for diabetes.
It is.
Especially.
It helps your body use insulin better.
So what kind of exercise are we talking about?
So 2 main types.
Okay.
Aerobic exercise,
Like what?
like walking,
Okay.
biking, swimming, dancing, anything that gets your heart rate up.
Right.
And then strength training.
Strength training.
Yeah, like lifting weights,
Yeah.
using resistance bands,
Wow.
or even just doing body weight exercises like squats and push-ups.
Right. And we recommend
At least 20 to 30 minutes.
of the aerobic most days of the week.
Most days a week.
Right. And then
And then strength training 2 days a week.
a couple times a week.
Yeah.
But you know what? Even if you can't do a full workout,
Right.
just little bits throughout the day.
Yeah, take the stairs instead of the elevator.
Exactly.
Park farther away from the store.
It all adds up.
It all adds up.
Now, another mistake we see is people thinking that eating healthy is just too expensive.
Oh, yeah.
We hear that a lot
Yeah.
at Sugar
It
Notes.
doesn't have to be expensive. There's a lot of affordable, healthy options.
Like what?
Dried beans,
Dried beans are great.
super cheap.
Yeah.
Lots of protein and fiber.
Huh.
frozen or canned fruits and vegetables.
Just watch the added sugar and salt.
Yeah, no added sugar or salt.
Right?
Buy produce that's in season.
Yes.
It'll be cheaper.
Yeah.
And meal prepping.
Meal prepping is huge.
Yeah, you can save a lot of money by cooking in bulk.
And you're less likely to make like a bad choice
Yeah, when you're hungry.
if you've got something already ready to go.
Right.
All right, so another mistake is skipping checkups.
Oh,
A lot of times people think, oh, I feel fine.
I'm good.
I don't need to go to the doctor.
Yeah, but even if you feel fine, there could be things going on
Yeah.
that you don't know about.
So it's really important to get those regular checkups.
It is.
Your doctor will check your blood pressure, your cholesterol,
Yep.
your foot health.
Look at your eyes,
Eyes?
your teeth, your gums,
It's
your kidneys. Make sure you're up to date on your vaccinations.
a whole body tune-up.
It is.
Yeah. Now, another mistake is expecting too much too soon.
Oh, yeah.
It's natural to want to see results right away.
You want that quick fix.
Right?
But both medication and lifestyle changes, they take time
They do.
to work.
Yeah. And you might not see a big change on the scale right away.
Right.
But you might start feeling better.
Yes, you feel better before you see the results.
So focus on those small wins.
Yes. Celebrate the small victories.
And speaking of things that take time,
Okay.
sleep.
Sleep.
A lot of people are not getting enough sleep.
No. And that can mess with your blood sugar and your blood pressure.
It can. It's so important
It is.
for diabetes management.
Most adults need 7 to 9 hours of sleep a night.
And if you're not getting that, talk to your doctor.
Yes, there could be underlying conditions,
Like what?
like insomnia or sleep apnea.
That could be contributing.
Yeah.
And last but not least,
Okay.
mental health.
Mental health.
This is something we are so passionate about
We are.
at Sugar Notes.
It's so important.
Because stress can actually raise your blood sugar.
It can.
And if you're feeling overwhelmed or stressed,
Don't be afraid to reach out for help.
talk to a therapist,
Yeah.
a counselor.
Yeah.
And remember, self-care is not selfish.
It's essential.
It's essential for your well-being.
So find what works for you.
Yes.
Like yoga, meditation,
Right.
reading, walking, spending time with loved ones.
Find what brings you joy
Yeah.
and make time for it.
Yes.
Okay, so we've talked about a lot of mistakes that people make,
We have.
but now let's move into some of the
Controversial
aspects of diabetes
research that we've encountered over the years.
Yes.
Working with Sugar Notes.
All right, let's do it.
Let's dive in.
Hmm.
All right, welcome back to the deep dive. We're going to get a little bit deeper into these common mistakes with diabetes, but this time we're going into some of the controversial areas.
Yes. A little bit more controversial areas of research and stuff that we've encountered over the years.
Right, working with Sugar Notes. So are you ready to go there?
I am ready. Let's go.
Okay, so one of the things that's been particularly interesting to follow is the Sipperstein controversy surrounding basement membrane thickness.
What is that?
So basically, Marvin Sipperstein, he was a researcher who, way back when, made quite a stir with his observations about muscle basement membranes
Okay.
in people who were newly diagnosed with type 2 diabetes.
Okay.
So he was seeing this thickness even in patients who hadn't had diabetes for very long.
Interesting. So what did he think was going on?
Well, his conclusion was that this pointed to a genetic predisposition to vascular complications in diabetes.
So he's saying that some people are just genetically
Wired for vascular problems.
more likely to have vascular problems.
Regardless of how well they manage their blood sugar.
So that's kind of a controversial idea.
It is, because if it's all genetics,
Then why bother?
right, what difference does lifestyle make?
Right.
It kind of took the focus away from those important things.
Right. So did his theory hold up?
So not really. Another researcher, Ruth Esterby, she came along and she challenged Sipperstein's findings.
Okay.
And she pointed out that basement membrane thickness is actually normal in people who are newly diagnosed with type 1 diabetes,
Oh, okay.
where there isn't that silent period before diagnosis that you see in type 2.
Oh, interesting. Okay.
So that casts some doubt on the genetic predisposition argument.
Right, because if it were genetic, you'd think it would be
You'd see it
in both types.
across the board, yeah.
Yeah.
And since then, research has largely supported that while genetics definitely play a role, lifestyle factors like blood pressure control, healthy cholesterol levels, and weight management are crucial for preventing complications.
So there is some,
Anyhow,
we're not just destined to have these
Yeah.
problems.
Yeah.
All right, what's another controversy?
Okay, so let's talk about the sulfonylurea battle.
The sulfonylurea
And
battle.
this one takes us back to the late 1970s with a study called the University Group Diabetes Program, or UGDP.
Okay.
And it suggested that sulfonylureas, which are a class of diabetes medication that help your pancreas release more insulin, might have harmful effects on the heart.
Oh, wow, that's a big glam.
So it created a wave of uncertainty and controversy, especially in the US.
Okay.
A lot of doctors in Europe, though myself included, were a bit skeptical of the findings.
Okay.
We felt like there might have been some flaws in the study design that could have skewed the results.
So there was already some debate
Right off the bat.
about whether this study
Yeah, but
fired it.
it was valid.
Yeah.
And as it turned out, the skepticism was warranted years later. Large-scale studies like the UK Prospective Diabetes Study, UKPDS, and the Advanced trial came along, and they essentially debunked those claims.
So they said, no, sulfonylureas are not bad for your heart.
They are not associated with an increased risk of cardiovascular problems.
It took 2 decades
Almost 2 decades.
to kind of clear their name.
Yeah, but eventually the evidence showed that they were okay.
So that's really interesting because it shows you that science is always
It's a process.
evolving.
It's ongoing, and we learn more over time.
Yeah, and one study
Doesn't mean everything.
is not the end-all be-all.
Right, exactly.
You have to look at the whole picture.
The big picture.
Okay, well, let's talk about blood pressure
Okay, blood pressure.
and diabetic kidney disease.
Yes,
So we know high blood pressure is bad for the kidneys.
it is very bad for the kidneys.
But there was a thought that maybe treating high blood pressure could actually make kidney function worse.
Right, so some doctors were seeing this slight increase in creatinine levels.
Creatinine.
Yeah, which is a marker of kidney function after patients started taking blood pressure medication.
So they thought, oh no, the medicine is
Backfiring.
making things worse.
Yeah, but as we dug deeper into the research, we realized that they were misinterpreting the results. That initial temporary increase in creatinine was actually a good sign.
So it meant the treatment was working,
It meant it was working.
not failing.
It was reducing the pressure on the kidneys.
Okay.
And that's a good thing in the long run.
Yeah, so it's just a matter of,
Looking at the whole picture.
yeah, seeing how things play out over time,
Right.
not just that initial.
Yeah, that initial blip doesn't mean everything.
Okay.
And long-term studies have shown that keeping blood pressure in a healthy range can dramatically slow the progression of kidney disease.
So another win for,
Proactive management.
yeah, being proactive.
Yes.
Okay, what about insulin analogs?
Insulin analogs.
So these are newer types of insulin.
Right. They've really revolutionized diabetes care.
Yeah, they give people a lot more flexibility.
Yeah, and potentially better blood sugar control.
But I know there have been some concerns about the safety.
One of the main concerns is a potential link between insulin analogs and cancer.
Oh, wow.
Yeah.
Scary thought.
That's a scary thought. Is there any evidence? So there have been some studies suggesting a possible association, but the evidence is still inconclusive.
Okay.
We always have to remember, correlation doesn't equal causation.
Right. Just
Two things happen. At the same time doesn't mean one causes the other.
Yeah.
So one large-scale study led by Julio Rosenstock compared the cancer risk in people using insulin glargine,
Okay.
which is a long-acting insulin analog to those using NPH insulin,
Okay.
which is a more traditional type,
Yeah.
and they found no difference in cancer risk.
Okay.
So over a 5-year period.
More research is needed.
More research is needed, but this is reassuring.
That's good.
Yeah,
All right. What about the Digamai trials?
the Digamai trials.
I've heard about those.
So these studies looked at the role of intensive glucose control
Oh, wow.
in people with type 2 diabetes who had recently had a heart attack.
So intensive glucose control, meaning like really tight blood sugar targets.
Very tight blood sugar targets, yeah.
So the thinking was that would be extra beneficial
Extra benefit.
after a heart attack.
Right.
Makes sense.
So the first study, Digami 1, actually showed some very promising results. The group that got the intensive glucose control had a significant reduction in mortality rates,
Wow. So case closed.
but not so fast.
Oh, no.
The follow-up study, Digami 2,
Oh.
which was much larger,
Okay.
did not replicate those results.
Oh, that's confusing.
It is. So this shows you how important study design and statistical power are.
Right.
That initial study might have just been too small to draw any conclusions.
Yeah.
And subsequent research has suggested that overly aggressive glucose control, especially in people who've had diabetes for a long time, might actually be harmful.
So it's not just about getting your numbers as low as
That's
possible.
how I'm finding that sweet spot.
It's about that balance.
Yeah, where your levels are healthy, but not so low that they put you at risk
Yeah?
for other problems.
Okay, so kind of like we were talking about with the medication,
Right.
you know, just because you can doesn't mean you should.
Exactly. You got to work with your doctor to find that right balance.
Yeah. Find what works for you.
Okay, so another myth that we've seen cause a lot of confusion is this idea that everyone with type 2 diabetes needs a kidney biopsy.
Oh, really?
Yeah. So this came about because some people with type 2 who had protein in their urine but no signs of retinopathy,
Retinopathy.
yeah, which is damage to the blood vessels in the eyes,
Okay.
had a specific type of kidney damage called minimal change disease
So they thought, oh, everybody needs a biopsy to
to rule this out.
check for this.
Yeah, but it turns out that minimal change disease isn't unique to type 2 diabetes,
Okay.
and biopsies are rarely needed
Yeah, good news.
to make a diagnosis or guide treatment decisions.
Yeah, kidney biopsies are not fun.
No, they're not.
All right, and lastly,
Lastly,
HbA1c.
HbA1c, this is a big one.
Yeah, the average blood sugar test
The average blood sugar test.
gives you a snapshot of your blood sugar over the past few months.
2 to 3 months.
Yeah,
But here's the thing.
Yeah.
It's not a perfect measure. Really?
of blood sugar control.
Interesting.
Studies have shown that people can have different HbA1c levels,
Even when their blood sugar's the same.
even when their actual blood glucose readings are identical.
Wow, why is that?
So it has to do with individual variations in how our red blood cells bind to glucose.
Oh, interesting.
So relying solely on HbA1c might not always give us the full picture.
So what does that mean for people with diabetes? How should they be thinking about this?
It means that while HbA1c is a useful guidepost,
Mm-hmm.
it shouldn't be the only factor
Right.
considered when making treatment decisions.
Okay.
So other things to consider:
Like,
frequent blood sugar monitoring,
Okay.
lifestyle habits,
right.
overall health.
So it's about the whole person, not just a number.
Exactly. The whole person, not just a number.
Okay, now what about the low protein diet for diabetic nephropathy?
Yeah.
Okay, so low protein diet for diabetic nephropathy, that's kind of a mouthful. It's an area where there's been a lot of debate over the years. So the low protein diet, sometimes called the Giovanetti diet, it was initially used to manage symptoms of uremia.
Uremia.
Yeah, which is a buildup of waste products in the blood that happens when your kidneys aren't working properly.
Yeah.
So the idea was to lighten the workload on the kidneys by reducing protein intake.
I see.
So as dialysis became more readily available, the use of this diet declined, but some researchers kept looking into whether it might have benefits for slowing the progression of diabetic nephropathy, which is kidney damage specifically caused by diabetes.
Okay. So did it help?
Well, the results have been mixed.
Next.
Yeah, some studies suggested a possible benefit, but others showed no real impact on kidney function.
So are there any downsides to a low-protein diet?
There can be. It can be really hard to get all the nutrients you need on a restricted protein diet.
Yeah, that makes sense.
And if it's not done carefully, it can lead to muscle loss and weakness.
That's not good.
No. So where do things stand now with low-protein diets for diabetic nephropathy?
Yeah, what's the bottom line?
Well, the general consensus is that they're not the first line of defense.
Okay.
Medications that block what's called the renin-angiotensin system, those are much more effective at protecting the kidneys.
So what are those medications?
They're called RAS blockers, things like ACE inhibitors and ARBs.
What do they do?
Well, the renin-angiotensin system is a chain reaction in your body that can lead to high blood pressure and kidney damage.
Okay.
So RAS blockers interrupt that chain reaction.
And I see.
They help to relax the blood vessels and lower blood pressure, which protects the kidneys.
So those are the go-to
Yeah, those are considered the gold standard.
for diabetic nephropathy.
Yes, but in some cases, a low-protein diet might be recommended as an add-on therapy.
So it's really about finding the right combination of approaches.
Exactly. Personalized care is key.
Wow, we've covered a lot of ground today.
We talked about a lot of mistakes that people make.
Medication mistakes, dehydration, carbs,
Exercise,
mental health,
sleep,
and then all these controversies.
all the controversies, yeah.
Here's the
Research. But I think the biggest takeaway for our listeners is that knowledge is power.
I agree.
The more you know about diabetes, the better equipped you'll be to manage your health.
Absolutely. And don't be afraid to advocate for yourself. Ask questions.
Yeah.
Do your research.
And remember, you're not alone in this.
That's right. There's so many resources available.
Healthcare professionals, online communities, support groups.
We're here for you too
Meh.
at Sugar Notes.
So, as we wrap up,
Yes.
what's one small change you can make today
To either improve your own diabetes management or support someone you care about.
that has diabetes?
It could be anything: drinking an extra glass of water,
Going for a walk,
checking your blood sugar,
checking in with a friend.
just a small step in the right direction.
Because all those small steps,
They add up
they really do.
over time
Thank you for joining us.
on this deep dive.
We'll see you next time.
Bye.